Sur Sanjeevan Music Therapy. Sur Sanjeevan Music Therapy.
Hello, I am Rajendra Dixit. I am Sur Sanjeevak of Sur Sanjeevan Music Therapy Trust. Actually, double-blind trials and randomized trials, which are conducted on various patients for their different ailments or disorders, wherein it was noticeably found that the treatment, the therapeutic treatment which was given through Sur Sanjeevan Music Therapy Trust on those patients, and the results were absolutely fantastic, as the patients have got tremendous relief from their ailments. So these points which I wanted to highlight as far as the trial reports are concerned, as against the placebo treatment, means you can say the pseudo treatment uh, which were given to the patient. So simultaneously, considering the therapeutic treatment from music therapy, Sur Sanjeevan Music Therapy Trust, and the placebo treatment, there was a vast difference, because the placebo treatment, which was just it was one kind of only entertainment, or you can say the distraction therapy. So what I mean to say is, so the music therapy treatment means the therapeutic treatment from Sur Sanjeevan Music Therapy Trust, which is absolutely conceptual, which is absolutely ethical, and which is absolutely scientific. So further, I will be saying that Dr. Sangeeta Sangvikar madam will be further elaborating on this particular subject in their forthcoming speech. Thank you.
Hello, I am Sur Sanjeevak, Dr. Sangeeta Sangvikar, and you are watching YouTube channel Sur Sanjeevan Music Therapy. As it is explained by Mr. Rajendra, various types of trials are conducted to check the efficacy of any treatment methodology. It was a large scale trial done on COVID patients. It was a double blind, randomized, multi centered control trial. For this COVID study, the protocol was designed by a famous cardiologist in Mumbai, Dr. Shekhar Ambardekar. As per his guidelines, we conducted the whole project. The therapeutic music was designed to treat COVID by the pioneer of Sur Sanjeevan, Dr. Pandit Shashank Katti. COVID was basically an infection that affected the respiratory system, and in turn that badly affected the endurance of a person, and that is why weakness, breathlessness were the major symptoms observed in COVID patients. Study of therapeutic music, the Sur Sanjeevan's therapeutic music on COVID patients was a large clinical trial, multi-centered and double-blind trial. Now, what do we mean by double-blind trial? Suppose I am a mediator. I have been given music by Dr. Pandit Shashank Katti and I am giving it to some of the patients. And another was audibly similar placebo. I got two types of musics and I randomly gave it to the patients. So I didn't know which is therapeutic and which is placebo. And the one who is using the music, the one who is listening to music, was also not aware. This is what is double blind. The one who is giving and the one who is taking is not aware which is which music. The patients were given this music to listen for the span of 15 days. And during this 15-day span, patients were advised to make the records of their own findings. Since COVID is a thing that affects the respiratory system and in turn it affects the endurance. So 6 minutes walk test was advised. The distance covered in 6-minute walk test was a major parameter that was observed in the study. The other parameters like oxygen saturation, the blood pressure and pulse rate were also monitored. And I'm very happy to share this with you that the group which had received therapeutic music at the end of 15 days of treatment with Sur Sanjeevan's treatment methodology, we observed the rise of 216 meters in 6 minutes walk test. Whereas in the placebo group, at the end of 15 days again, the distance, the rise in the distance walk was observed as 85 meters. You yourself now can compare 216 meters versus 85 meters. So which is better? Obviously, the therapeutic group is better. Pulse and oxygen saturation. Of course, we got the difference in figures, but naturally these figures are maintained in a very narrow range. So the difference observed is not as significant as it is observed in the distance covered in 6 minute walk test. 216 and 85 is a sizable difference. The same amount of difference it is difficult to get in the parameters which are naturally maintained in a very narrow range, like oxygen saturation, pulse, everything. Even the symptomatic parameters were observed. And the very first symptomatic parameter observed was, these the pulse, the distance walked, and even the oxygen saturation, these are the parameters which can be expressed in terms of figures. But there are certain parameters which cannot be expressed in terms of figures, like weakness, like negative thoughts, negative thinking. And the common symptom in COVID was the loss of sense of taste and smell. This cannot be expressed in terms of figures or numbers. For this also a protocol was designed. The patients were asked to rate themselves on the scale of 1 to 10 on relief, on the amount of relief they got. And for negative thoughts, we got the similar results because music creates positivity. So the negative thoughts were well under control in both the groups. But the COVID related symptoms like breathlessness, cough and cold, loss of sense of taste and smell, there was a significant difference found in the relief obtained in therapeutic group versus relief obtained in placebo group. This clearly shows the efficacy of Sur Sanjeevan treatment. COVID was a phase which all of us we suffered for almost 2.5 years. What after that? Respiratory infections are very common all around the year. Reasons are many, like pollutions, the weather change, temperature difference, everything. Symptoms are more or less the same, like cough and cold, breathlessness is there. And since the lungs are affected, the endurance factor is also there, which is very common. After the COVID project, we tried the same medicine for respiratory ailments also. The therapeutic music which is designed, basically is designed to strengthen the respiratory system and to boost the immunity. These are the factors required in any respiratory infection. So the same music was later tried in the patients of respiratory infections, where breathlessness was observed, cough and cold were the very common symptoms, and even the endurance. And we got the same results. That clearly indicates the efficacy of Sur Sanjeevan music. I hope this has created enough amount of interest in your minds. If you have any of these problems, if you suffer from any respiratory infection, do come to us for Sur Sanjeevan therapeutic music. Thank you so much.